Today we're going to talk about how to improve estrogen metabolism in the body. Welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday Goli, nurse practitioner here at Revitalize MD, and today we are going to talk about yet another supplement.
DEM. What is DEM? Well, it's really considered the estrogen detoxifier,
Yeah.
right?
So let's just cut right in and go right into like a little bit of science behind it. What are the pathways behind DEM? What is it? And then we can get into the benefits next.
So if you are eating cruciferous vegetables, there's an ingredient that is I3C in cruciferous vegetables, and so then it metabolizes in the body to DEM. And so DEM helps estrogen metabolize the right way. It actually brings it down as well. And so if somebody has elevated estrogen, a woman, whether they're estrogen dominant and they're in perimenopause, or whether, maybe their estrogen's a little high and we're optimizing it and kind of working through that customization, or men, because men will come in frequently and have an estrogen elevation or symptoms thereof. And so if we want to bring that down fast, or if we just want to metabolize it better or to a safer pathway in the body, then we can use DEM to bring that down. Or you can eat a lot of vegetables, and so a lot of people aren't getting enough vegetables. So,
And you've got to eat something crazy like 5 pounds of raw broccoli to get 100 milligrams of DEM.
And there are some supplements that will actually start with I3C and then convert to DEM, but DEM is a frequent one that we use. And again, there's some pretty standard dosing that we'll get into and in the exact effects. But basically, estrogen in the body will convert to 3 pathways. It'll convert to they're hydroxylation pathways, and so 2 hydroxylation, 4 hydroxylation, or 16. And so 2 is the best pathway, 4 is the worst, and the 2 to 16 ratio matters, and some of them bind to the estrogen receptor a little differently. Their potency is different, but the bottom line is we want more of the 2 hydroxylation pathway, less of the 4, and a better ratio of the 2 to 16. And what DEM does is help you metabolize it the right way in addition to metabolizing it better. And that's a pretty simplified version of the estrogen metabolite pathway.
And I think that without getting too sciencey and losing everybody, I think that's a good explanation, is that we've got good estrogen, we have bad estrogen, and we have ratios of estrogen that we want to maintain to be healthy individuals, whether we're men or women. So by taking the supplement, we can help support that. So one of the ways we help support that is how DEM affects testosterone. In one of our other podcasts, we were talking about a supplement called stinging nettle, and we talked a lot about how we use that a lot in men versus women. Well, in this supplement, we use it a ton in women and sometimes in men, but it does have its benefits for both, because just like women, men want healthy metabolism of estrogen. So the way DEM can help with testosterone is indirectly. It helps testosterone stay testosterone through its metabolism of estrogen.
So if, again, you have testosterone in the body and women have testosterone, it's the highest hormone in our bodies, the most abundant circulating hormones in a woman's body. It's just not as high as in a man's body. So that can convert to estrogen. And again, we already make a lot of estrogen. And so women in perimenopause tend to be estrogen dominant. And during that time frame, we have a lot of bleeding. We have a lot of things related to estrogen.
Acne,
Dominance,
weight gain, water retention.
Yeah, and proliferation. So estrogen proliferates tissue, breast tissue, and uterine tissue. So you get excess uterine proliferation, which causes bleeding, causes endometriosis, can cause fibroids, and that's in perimenopause. And so in perimenopause, a lot of times it leads to ablations or hysterectomies because of that excess estrogen. And of course, you can balance it with hormones or progesterone, and you can do those levels. But one of the most natural ways to bring down an estrogen dominant phase of a woman's, hormonal, journey, I guess,
That's a perfect word for it.
because there's lots of different phases we'll go through, is to actually use DEM just to help convert, help to metabolize it, but then metabolize it down the right pathway as well.
Exactly. So DIM helps convert down the correct pathway. It helps get rid of that excess estrogen in a healthier way. The body can metabolize it out of the body healthy. And then that allows our testosterone to remain testosterone, and it helps with some of those symptoms. So premenopausal, so perimenopausal women that are still cycling can take this just pre-cycle when their estrogen is the highest or at the beginning of their cycle to help with PMS symptoms. Or some women need it continuously, monthly. They are on it always. So with that said, there are lots of benefits to it. However, in our postmenopausal women, if we're not making a lot of estrogen, we don't want to be taking something that lowers estrogen even more unless directed by your physician or hormone provider, because it can drop estrogen even lower and exacerbate symptoms of low estrogen.
Yeah. Well, and that's the pretty remarkable thing that we've seen with women that were optimizing in hormones in that perimenopause or menopause stage. And again, in perimenopause, it's more of a natural because we're not optimizing or giving estrogen. We only start to give that in menopause. But in menopause, if, say, we're a woman's new to us and we're doing their hormones, we haven't yet really got their dosing perfect, and say their estrogen bumps a little bit, or say their body's just getting used to it again and it seems high and they're getting those estrogen dominant symptoms, because it can be emotional, water retention, the things that you're talking about. But it brings it down very quickly.
Very quickly and very effectively.
Yeah, so I would definitely think of this one in perimenopause if you feel estrogen dominant, which again, if you think about that premenstrual, people have like PMS. That's kind of what we're going through when we're estrogen dominant later on. So you get more emotional, sweaty, irritable,
Yeah, night
anxiety.
sweats
Yes.
is huge.
And so night sweats, even the just bloated and
Jawline acne is another one I hear a lot in my younger patients. They're like, I just break out right before my cycle. Usually it's due to the estrogen.
And again, the 7 dwarfs of menopause are estrogen dominance. I think it's the 7 dwarfs of actually probably perimenopause.
Perimenopausal.
Because you're moody and you're, irritable and bitchy and bloated and all that stuff. So this is something that helps with that. And so when we're talking about breast cancer and pre or postmenopausal, some of the studies we are about to bring up actually talk about how it metabolizes it to a better pathway. So something to think about even with a breast cancer history is that DIM is something that will metabolize it down a safer pathway. And so this is a safe supplement to use.
And that study that Dr. Durst was talking about was actually a pilot study of 19 women. It's unfortunate that supplements are not as well studied as pharmacological medications, because this is one that study showed that 19 women, so 10 that took DIM, 9 that took a placebo, it showed that those women, the study found that DIM had a shift towards healthier estrogen metabolism, which may reduce cancer risk. So even though it's a small study, it showed a pretty significant change in estrogen metabolism in that study. So when we're talking about cancers and we're talking about reduction of cancers through healthy estrogen metabolism, this is a very safe supplement that comes from a vegetable source that we should have more studies on, because it's pretty amazing, the benefits. There was a larger study on DIM that was, so this one was a large study looking at estrogen metabolism through urine samples. So when we look at urine, we can see metabolites of estrogen. We can see how estrogen breaks down, and we can look at that 2, that 4, that 2 to 16 ratio really well on paper to say, okay, is it effective? Is it not effective? And this study, I don't remember the year, so I'll have to go back and look at that. But it was just shy of 130,000 individuals. So it's a pretty big study. 909 were taking DIM, 18,000 did not take DIM. So those were kind of the end results out of all the people that they were able to follow. And what it showed is that that DIM does help the body process estrogen in a healthier way when looking at dried urine samples. So that's huge.
I was trying to look. It was 2024, actually.
Yeah, I knew it wasn't super
Yeah.
old. I just didn't want to misquote it.
Yeah, 2024 was that one. So a very recent one. And again, our studies for DIM and supplements are not large, unfortunately.
No.
You know, and if you look at, so a lot of times, and again, you'll hear me talk about this over and over again in multiple podcasts that we do, is that we in medicine want these randomized controlled clinical trials, you know, but it is difficult to do if it's not drug company sponsored. There's got to be money that actually produces that. And so it's great if the government is doing it or NIH, but sometimes I even look at some of those studies and it still has a backing in some way that, you know, refers back to pharmaceutical companies. And so if we're dependent on large randomized controlled studies and it has to be funded by something with a vested interest, then is it really, you know, a non-biased study? It used to be that it was a non-biased, but frequently, and we've seen way too many of them, that they can actually twist and tweak those results to fit what they want. And so anyhow, that is one of the things, that this is a supplement, so it's naturally occurring. It isn't a drug. It doesn't have side effects with other things, and it does help you metabolize your natural hormones in a better way.
Yes.
And potentially more effectively. So it is safe. And there hasn't been any safety concerns with it as well.
No.
But large studies you might have trouble finding. But again, I think we have enough studies to show that it is. And there's another one. It was a smaller one, but again, it was postmenopausal with a shift towards a healthier metabolism in the good estrogen.
Yep.
And so again, Faraday points out an important point is that we can do blood levels. Many will talk about salivary testing of different hormones, but that's a more difficult and not a standardized thing to communicate.
And more expensive for patients, just not realistic.
Yeah, it's more of an academic point than actually blood work. And so blood work is what we follow. But to get the metabolites, you actually have to do a urinary test. But this is what they've done in the studies, is look at the urinary metabolites of estrogen or estradiol or estrone. So basically, I always say look for recommended dosing. There's definitely dosing there, but it also depends on, so it ranges anywhere from 100 to 300 milligrams a day. And you can adjust that based on their improvement of symptoms if they happen to be estrogen dominant. But this is one of those supplements that ladies can think about looking into if you're starting to feel that and you're not seeing a hormone specialist. But this is something that we use on a regular basis in our female patients for a better hormonal health picture for women.
Yeah.
And so
Perimenopausal women, if we're having symptoms of estrogen dominance, which we've already discussed, that Dr. Durst discussed a little bit earlier, this is relatively safe. It's not going to be a problem to take. Our postmenopausal women, if you are not on estrogen therapy and you take this, it may exacerbate your symptoms because you're lowering estrogen even more. So if we're having hot flashes and night sweats and weight gain because we are no longer making estrogen, taking something that further decreases estrogen in our body is not something you necessarily want to do. Now, if you are on hormone replacement, this is something that your hormone specialist should be very well versed in and should be able to help guide you on dosing to help with any symptoms while on estrogen therapy.
Yeah.
The only other thing with this would be for men. Men, when you're taking DIM, it's extremely effective in lowering your estrogen. So if you're on hormone replacement therapy and you're on another aromatase inhibitor like anastrozole, you may not want to use this on top of that. It may lower your estrogen too much. So just a few little things just to keep in mind. DIM is fantastic to help potentially increase free testosterone by lowering sex hormone binding, but it is not going to increase testosterone directly because it does not have any effect on luteinizing hormone. It's all through estrogen modulation.
Yeah, great points. Definitely great points for everyone to hear. And so I think that The only other thing that I would think is that if you're already, on any aromatase inhibitor, also breast cancer, history, or treatment for breast cancer, that is definitely something you want to address with the hemoncologist or your doctors, and not just go and take supplements.
That's That is probably the exception of being on an aromatase inhibitor as our breast
Yes.
cancer patients is you can't have your estrogen too low. And you
Yeah.
can't have your estrogen, anything that's going to help healthy metabolism of what you make to go down the correct pathways and avoid those bad pathways is beneficial.
Yeah, because men do need a healthy, level of estrogen. Some tend to like it on the low side, and they feel like that they're getting, breast tenderness or breast enlargement. And most of the time, that doesn't really end up being the case when their estrogen level is reasonable. And I'd say between like 15 and 45 is a reasonable goal, and 15 can be even on the low side. But some men will want it lower, but you need estrogen for sexual function. Some men need it more than others. And
Bone
then
health,
also
brain
for
health, cardiovascular health.
prevention. Yeah, so you don't want to be without estrogen. So definitely have this followed by a healthcare professional or hormone specialist. And if you're already on something that modulates it, do not add it in without being monitored and actually having that checked to make sure it's an okay supplement to take. If you have any other questions, let us know. If you want to share anything that you have found with Dem, please do. Let's start a conversation in the comments below, and let us know if there's anything else you want to talk to, because we are willing to deep dive into anything wellness or sexual wellness